Before Uganda imported COVID-19 vaccines, the Ministry of Health had laid out the priority groups of people supposed to get the shots before the vaccination is rolled out to the general public. Among those on the priority list were the frontline health workers, police and the army personnel, teachers, the elderly, and people with underlying health conditions. However, since the 954,000 vaccine doses reached the country, the list of priority categories of people continues to change.
The Minister of Health came to ask me to allow them to vaccinate you. So we have arranged on Thursday and Friday, all the members, old and new, to come for vaccination for COVID at the Parliament House.
And indeed today, medical workers spent a day at Parliament vaccinating MPs, some of who are below 50 years, yet many teachers and health workers have not yet been vaccinated. Health Minister Dr. Ruth Aceng explains why.
Our members of cabinet and members of parliament are leaders. The majority of them above 50 years of age, and they also interact very frequently with the population. Now, we have been engaging on a regular basis, including carrying out a pre-registration. And the analysis of the pre-registration put them in the population at risk. Some of them for purposes, for their age group, and the others because of other comorbidities.
Despite MPs interacting with various people, Dr. Cheng says the legislators are also trying to lead by example.
There has been a lot of petitions from their electorates that if we are to vaccinate them, they would like to see their leaders vaccinated. And therefore, we requested that the members of parliament should be vaccinated in camera for their electorates to see that their leaders have taken up the vaccine.
The Ministry of Health is yet to ascertain how many of the newly elected MPs fall under the category of those who are 50 years old and above, and even others who have comorbidity issues before they can vaccinate them. The current MPs who are going to be vaccinated are estimated to be about 3/4 of them, but isn't this number too big for just a mere demonstration to show the electorate that the vaccine is safe?
Many of you are aware the vaccination process is voluntary. It is not true that all will come up and get vaccinated. But when we conclude the vaccination exercise, we will let you know how many have gotten vaccinated.
Makerere University has also issued a notice to all its staff to ensure they go for vaccination.
The Makerere University staff are part of the teachers and the lecturers. They are listed among the priority groups because we are all preparing to open the schools.
There are also reports that there are some people from the private sector who are getting the vaccine, yet they do not fall under the categories listed by the Ministry of Health.
It is good information that you're bringing to my attention. I'll make an inquiry and understand what is going on.
It is hoped that as the priority groups supposed to be vaccinated change, vulnerable groups such as the elderly and those with underlying conditions won't miss out on the vaccination. Sudil Ruhanga, NTV.